Good Tuesday morning and welcome inside the 977 The Bullet Studios. It's time for yet another edition of the Your Care on Mission radio show, presented, of course, by the Humboldt County Memorial Hospital. My name is Nathan Blackwell. I am the host of the program. We have a two-pack of guests here for you on this April morning. First, we're chatting with Gabe Ratzlaff, a physical therapist at HCMH. Gabe, good morning. How are you?
Well, good morning. Thanks for having me. Doing very well. Yes, I'm a physical therapist at Humboldt County Memorial Hospital. I'm working here for about 4 years. Just kind of here today to talk a little bit about our physical therapy department and some of the services we provide. We've got a staff of 4 physical therapists and 3 assistants working with us, treating a variety of different things, but not limited to things such as joint pain, muscle pain, sprains, strains, balance issues, vertigo included, any sort of fall risk, being unsteady on your feet. We also help with people after surgery, whether that's an ACL rehab or someone has a total shoulder, joint, or knee replacement, rotator cuff repair, back surgeries. We also work with sports injuries, athletes, anybody dealing with any sort of weakness. Kind of our goal is to kind of help people feel better with less pain and get around, or any other kind of physical goal someone may have. With working with patients, the treatment is individualized to the person, and that's kind of set up on the first treatment. Treatment can include things as stretches or strengthening exercises, manual treatments, ultrasound. We do kinesiotaping, TENS units, sometimes people have heard of, called electrical stimulation, a lot of different exercises or bracing. We also do things like dry needling. Not a lot of people have heard about dry needling, but one of our therapists, Jack, he does a great job with that. So yeah, your care is individualized for what's going on, and that's all set up on the first treatment.
When it comes to your clientele here in Humboldt, what is the majority of the people you're seeing? Are they younger kids, older people? What are you dealing with?
Well, with Humboldt County, it's kind of, it's an aging community, so we do see a lot more, maybe retiree type people, but we work with all ages, We even see every now and then some infants all the way, up to 100 plus years old. Just kind of depends on what's going on, work with anything. For us to see you guys, see a person for treatment, you do have to have a referral from your doctor. So you got to see your Dr. Dvorak or whoever your primary care physician is. If you're not sure that therapy or physical therapy would be the right thing for you, you can always call the hospital and ask for rehab and talk to one of our therapists. We'd be more than happy to help you with that conversation and kind of help point you in the right direction if need be. Also should point out the entrance to the hospital for therapy has changed. Going around now the back side of the building, back by the surgery center is where the main entrance is. And there's a new welcome desk area set up to kind of help patients and loved ones get around the hospital or where they need to be. But it should also be noted that the entrance to the emergency room has not changed. That's in the same location.
Awesome. Just a couple questions on my end. In terms of physical therapy and the way you're treating people, how have new technologies in the medical field in physical therapy, how has that, helped what you guys do in your office?
Well, it's just speeding up the recovery in general. New technologies, whether that's the surgeons are doing new techniques that are less invasive, so not as much bleeding and not as much scarring, helps people get back faster. Newer technologies, whether that's different techniques with dry needling or kinesiotape, or just new studies in general, research showing faster ways to recover and get you back out there and to feeling good.
When it comes to rehab, what are some harder injuries that you have come across that are harder to rehab than others? If it's a knee, an ankle, shoulder, elbow, stuff like that. I mean, when it comes to what you deal with, what are some of the harder rehab injuries, I guess, you have to deal with?
It's kind of a case-by-case basis.
Sure.
But, sometimes whether someone's recovering from having a stroke, kind of be very difficult, not only that patient but the family aspect.
Right.
Sometimes those are more challenging. Or if we're just talking orthopedic injuries, typically shoulders tend to rehab a little slower than maybe a knee or hip. But that's kind of a hard one to say. Everyone's kind of a different age groups heal faster and case by case basis.
Sure. And then, pardon me, you want to detail a couple events that are coming up?
Oh yes, we've got a couple events. One is coming up here at the end of April, Tuesday, April 24th. The auxiliary is presenting a jewelry sale. It's a silent auction. It's Friday, April 27th from 10 to 4, and Saturday, April 28th from 9 to 11 at the conference room in the hospital. And again, just come in the main entrance, and the gals at the front lobby will help direct you to where you're going. And then Friday, June 8th, we're doing a golfing outing fundraiser by the foundation. And the registration for that is open. You can find that at the website, www.humboldthospital.org. And that is, again, June 8th, but sign-up's open now.
I wonder if there'll still be snow by then.
That's a good question.
Hopefully not. Well, thanks, Gabe. It was an interesting conversation. I appreciate it. You're a first-time guest, aren't you?
I am.
How did it feel?
That's good. It's
Okay.
a fun time. Glad to be back. Glad to be here, maybe back soon.
All right. That's Gabe Ratzlav. He's a physical therapist. We'll take a break, come back with Katie Legvold right after this on the Your Care, Our Mission radio show.
Hi, my name is Jacob Miller, Humboldt County Memorial Hospital's new certified registered nurse anesthetist specializing in pain management. Don't let pain manage your life and schedule your pain consultation with me today. I offer many types of pain relief, including lumbar, thoracic, cervical epidural steroid injections, medial branch blocks for cervical and lumbar back pain, blocks for knee, hip, and shoulders. Pain is unwanted and difficult to tolerate. Call Humboldt County Memorial Hospital today and ask to take your first steps in managing your pain at 515-332-7669. Referrals welcome but not necessary. Our mission is to always provide you with excellent pain management so you can get your life back. Your care, our mission.
Welcome back inside the 977 The Bolt studios. Nathan Blackwell with you for the Your Care, Our Mission radio show. First segment, we discussed physical therapy and all that it entails over at the hospital with Gabe Ratzlav. Now we're joined by, I should say, Katie Legvold. She's an OT specializing in lymphedema. Good morning, Katie. How are you?
Good morning. Thanks for having me.
Absolutely.
I'm Katie Legvold. I'm an occupational therapist and a certified lymphedema therapist at HCMH. And I'm excited to share with our listeners that the rehab department can provide lymphedema treatment right here in Humboldt. So my goal this morning is to provide a little education on what lymphedema is and how we treat it. So most people in general do not know what lymphedema is until they're diagnosed. It's a swelling in the body which can occur in the limbs, trunk, abdomen, or face. It results when protein-rich fluid accumulates in your tissues or your skin. And it's different from just regular edema because edema is more of just a water fluid, not the protein-rich. So it's just a different type of fluid that accumulates. But it can cause significant changes to the body if it's not treated. So once it's present, it does require intervention and usually lifelong care. So what causes it? There's two classifications. There's primary lymphedema is something that a person would be born with, where their lymphatic system has a malformation. And the secondary lymphedema would occur in a regularly healthy lymphatic system that's injured or damaged. So this could be from cancer treatments, surgeries, radiation, removing lymph nodes, any severe circulatory insufficiencies, traumas, or infections can damage the lymphatics. So breast cancer surgeries are actually and treatments are actually the number one cause of lymphedema in the United States.
It's insane that you say that because back in high school, my mom went through breast cancer, and then she suffered from lymphedema as a result of that. So now I can tie the two and two together.
Yeah. Had you heard of it before that?
No.
Had
I was
mom
also
heard of it?
14 at the time. No, I don't think she did either. Maybe she did, but she had to wear a sleeve on her arm because her arm was swelled.
Yeah.
Yeah.
There you go. So that treatment,
There
that
you
would be
go.
what I would help her with.
There you go. Well, cool.
What does lymphedema look like? Well, usually it can be swelling that comes and goes, but over time, with that protein-rich fluid, the skin can become kind of hard. And as it progresses, the skin doesn't get the nutrients it needs, so it becomes unhealthy, and the risk for infection goes up. So if swelling happens in 2 limbs, usually it's asymmetrical. How do we treat it? Well, we treat lymphedema with a 4-part process and kind of use it as we need to. It's called complete decongestive therapy. So part 1 is just taking care of the skin. We want to make sure it stays healthy as we go through that process and reducing the risk of infection. Part 2 is manual lymph drainage, and it's just kind of a gentle manual treatment. Not really a massage. It's actually pretty light. So a lot of people may even fall asleep on my table as they're sitting there. So. But it assists in moving the fluid manually from the damaged areas to healthy areas so it can get removed from the body. And part 3 is compression therapy, a gradient of compressions used to prevent the reaccumulation of fluid. So we're working to get it out, but we also want to keep it out. And that's applied by bandaging initially, and then as the person progresses, they usually do something at home, like wear the sleeve. For a leg, it might be compression stockings, which a lot of people are familiar with. And the last part's exercise. Usually once the person starts, I teach them an exercise program, and they need to go through that on a regular basis to maintain that reduction of fluid. So the muscles can help squeeze out the vessels and move fluid around. And then there's just precautions with that. I'm sure your mom had this with avoiding blood pressures on that arm or injections, things like that. So there's just a lot of education with this also, especially with it being such a lifelong process that you go through. It's something that a lot of people don't know about until it happens, and then it affects your whole life the rest of the time. So,
well, a couple of questions I have. First and foremost, my girlfriend's actually in OT school, occupational therapy at Allen College. So when you went, did you have to specialize in lymphedema, or is that something that you acquired after you received your master's?
Yep, you just get your master's first, and then it's called a certification. So it's a 135-hour process. So over home study and course study, I got 135 hours and became a certified lymphedema therapist. I did have to take a test at the end, so had to pass the 3-part test. So
interesting. Well, I like to know more about this OT business that my girlfriend is getting into. I talked to who did I talk to about a couple weeks ago? Another OT from the hospital. Let's just leave it at that. It's actually OT month in April.
Yes, yeah.
Well, congratulations on
Thank
that.
you.
I appreciate you coming in. Anything else you have for us here this morning?
No. Anybody seeking treatment, same thing as Gabe said. We need an order from the doctor. So contact your doctor first, and your doctor can determine where the problem's really coming from, and they can always refer you to therapy services for anything you might need, including the swelling. So.
Awesome. Well, thanks both to you and Gabe for coming in here on a Tuesday morning. We appreciate it. Hopefully we'll see each other in the future.
All right. Thank you.
All right. That is another edition of the York Area Mission Radio Show on 977 The Bolt. You can listen back to this if you missed it. 977, all numbers, thebolt.com on demand. Thanks for listening. Have a great Tuesday.